Hi, Dr. Sam Forlenza here from Doctors Chronic Health Solutions. I just wanted to take a moment and go over a quick tip with you. I was chatting with a colleague the other day, and we were talking about some of the symptoms of peripheral neuropathy. And a lot of you know what the symptoms are: the burning, the numbness, and the pain. And you probably know from some of my previous videos why this occurs. And like I always mention, there's a host of reasons. It could be secondary to chemotherapy treatment, secondary to diabetic type 2, secondary to medications and neurotoxins and so on. But one thing that I want to stress is I want everyone to be aware of this tip. When it first starts, let's pay attention to these signs and symptoms. And you might say, I've got a little bit of numbness in the toes, and then it goes to the other foot, and maybe a little bit of numbness in the hands and so forth. And then things start to progressively get worse. And as you all know, with peripheral neuropathy, it is a progressive disease, and a lot of the doctors will treat it with, they'll treat the symptoms with medications like gabapentin and Lyrica, and sometimes pain medication. But the purpose of this video is just to pay attention to the symptoms. And one thing I want to get into is how these symptoms can eventually affect balance. Balance is something that we have to be concerned about. We all need it, obviously, and a lot of you know that the inner ear is a big area that helps us with our balance problems. Another one is our vision, our sight. When we're looking straight ahead to the horizon, we gather information and we can see the horizon tipping one way or another, and the signals are sent back to our brain to try to cope with that and keep us upright and keep us from falling. But as a symptom of peripheral neuropathy, we start getting this numbness, and particularly in the bottom of the feet. Well, on the bottom of the feet is another balancing area, just like the inner ear and the eyes, and has to do with propriosensory, or these propriosensory nerves endings give information to the brain, and if this numbness is there, it starts to not be able to compensate. And over time, as peripheral neuropathy progresses, as you know, we lose our ability to balance, and it causes a lot of other problems, especially in the elderly, where falls become detrimental. And it's not the fall, it's not the fracture. Okay, but what happens is the infection that could set in that would cause us problems. So the key takeaway of this video is, please, pay attention to the symptoms. These symptoms progress. Balance is one of them. We all know the other symptoms that are just very, very painful and very, very uncomfortable. Anyway, if you have any questions, we're here to answer. The phone number, as usual, is at the bottom of this video. My staff is here, I'm here, and we do offer a free consultation. We do that a lot. It's a very good, informative process. Okay, so anyway, we'll be seeing you real soon. If you have any questions, give us a call. Take care.